them a group photo so that they can come down. The next committee to present will be Education and Research Committee.
As a ship in the house, a Bible in the bay, no crawford say Nara, so just snap in the bay. Into girls and I do chapel, or pay no browasher, one as soon a clap or bay. Into Yamasumpa, Nayarisumia, Bisa Wunya, Nabisa Wasum, then Yamasumpa, Nayarisumia, Nawunya from when.
We will skip Education and Research Committee and move to Socio-Economic Committee. But I called you to come forward. So we will have the Education and Research Committee do their presentation now, to be followed by Socio-Economic Committee.
I won't put on the things fall apart. Echo was anointed men touch. Chapel was school supply. Then some members went to me for one copy. In Yamisumpa, Nayarisumia, Bisa Wunya, Nabisa Wasum, then Yamisumpa, Nayarisumia, Jasumamia, Ericuna Jinadani, Yamisumpa, Nayarisumi, Numna Mambo as old as Shabitasi, Yamisumpa, Nayarisumia. Come on, so afraid you are. Nazia Eke Wadawa, Maramushabu, Nazia Dawarano. Come on, so afraid you are. Now, Wadawa, no more.
Thank you, Madam President. So, this committee is chaired by myself, David Tenkrachum, and we have Francis Winnie as the secretary. Members include Reverend Chairman Hefolai, Professor Samuel Ajolulu, and then Mr. Samson Yali. Thank you for having us.
Good morning to us all. Education and Research, the only visible committee. Visible on social media, that's what I mean. So the Education and Research, as we are aware, we are presenting our mid-year report spanning from 2024 to 2025. And so the committee, as we are all aware, is a standing committee of the association. And the association has a mandate. The mandate is to provide professional excellence. And we carry this mandate. Of course, our efforts over the period is based on what is enshrined in the Constitution and that of the strategic plan. And basically, what we are into is to provide continual professional development, training, build capacity for members through webinars. And so that is one of them. The other one has to do with conducting research to influence policy or inform policy as well. The committee, the members of the committee is made up of nurses, who are clinicians, nurses who are into education, nurses who are into research. And I am to tell you that that's the only committee with all the titles involved. We have the professor, we have the reverend that preach and change things for us, and we have the doctor who make a difference. And I'm also one of them. the majority of you, the misters, were also there. Exactly. So that is the committee, the members that made up of the committee. So this year, as part of what we are into, this year we organized a series of webinars. Last year and this year we organized a series of webinars, and we had a lot of attendance. A lot of people participated, and we'll take, if we can get the slides, it will help us so much. So that but let me say that the CPDs, we had issues with our CPDs with NMC. They said they would not recognize our CPDs because members reported that they were just flipping through. You just scroll, and you get the points. So we had to apply for a certificate to be a consultant. I mean, an organization that provides CPDs training. And so this year, we had the certificate. We are recognized, and any webinar we have and you participate, just be assured that you get your CPD points. And so we will be renewing the certificate every year. But the certificate came with some conditions which members must apply. One of them has to do with the fact that you must enter with your PIN number, your PIN. Those of us who will not enter with our PIN, you won't go through. Then the second one is your NMC registration number, which you have to provide. The third one has to do with your staff ID, then your rank. Then you either say you are a member of GRMA, either you choose yes or no. So this year, all our members were encouraging everyone that as we are conducting CPDs, make sure you have these items on your phones so that the moment you want to log in, it's easy. Let it now be part of what you will, that will be in your phone for any CPD training we'll be providing. That is one of the things we are doing. Then the second one has to do with the fact, and under this, the last webinar we had, let me announce that we had 7,000 plus members who joined with their, who participated, and then their pins, we have exported the information to NMC, and they will be getting their CPD points. 7,600 and something. I can't get the figure right, but 7,000 plus. And that's very, very good. And the collaboration aspect of us, we are doing so much when it comes to collaborations. If you remember, yes. But I gave them I have it on, but. So let me continue. As you are aware, we are into partnership. We partner with organizations outside. The last CPD training we had to partner with. So let me continue with the CPDs. So we started the period with one CPDs that talk about one, conflict management, and two, customer and respectful care concept. And that CPD training, we had about 567 members that participated. 567 members participated. And we learned a lot in this webinar. They took us through characteristics of respectful care, and those concepts were beautiful. If you haven't joined, you miss a lot. Then the second webinar had to do with barriers of midwifery and midwifery practice. And the other one had to do with hepatitis B infection, which was led by Professor Ajay. And we learned a lot. In that webinar, we had about 600 members participating through the Zoom link. And that was very good, very, very good. The second webinar was on discharge against medical advice. Discharge against medical advice. This one we partnered with some number of doctors, and they took us through the role of the nurse against discharge, on discharge against medical advice, the role of the midwife, the role of the doctor, and that of the role of the doctor. In that webinar, we had a challenge. Only 547 members participated. And this wasn't good enough. We acquired a Zoom link of 1,000, only to have 547. But we were okay for that one. But the second one we had was on, what do you call it? So the second one we had to do with, we had to organize webinars on EBP, evidence-based practice. Evidence-based practice. In that webinar, we had to collaborate with evidence-based experts across the entire world. So we had experts from Canada, experts from US who took part in training us. And it was very, very successful. I mean, we were taken through what is evidence-based practice. We were taken through the characteristics of evidence-based practice. And we were taught to make evidence-based practice the DNA of our healthcare system. And it was very beautiful. If you haven't participated, you miss a lot. I mean, when it comes to good terms, evidence-based practice, holistic care, nurses say we are into it, but we barely have no knowledge on it. But that webinar opened our eyes and was very, very successful. Then we went to another webinar, Patients and Safety Concept. This one too, we collaborated with professors outside the country. We collaborated with other organizations, experts on quality care, experts on patient safety, and we had a lot of participants. We have a lot of participants. In that webinar, that was the webinar that we had 7,000 plus members registering and people participating. We have exported all your data. We are submitting it to NMC for you to get your CPD points. Then we have the next webinar coming. The next webinar is going to look at how to improve quality care service. How to improve quality care service. And we have five facilitators for this webinar. 5 from outside the country. All these experts are there. And they will come and give us a lot of knowledge, a lot of experiences, how to improve our safety, how to improve our care. So we are praying that you will participate. And they are proposing a date, either 3rd, 4th, or 5th. Yes. Okay. So this is the webinar I am talking about. These experts are coming. As you see, none of them is in Ghana. They are all outside the country, and so they'll give us a lot of experience. They will share their wealth of experience, and they will educate us so much. But let me take you through our CPD's certificate, so that we get to know and we all be assured that we have the certificate. So this is the certificate that I talked about. So from NMC, and so we are granted in providing you all the training you need. And these are the webinars I spoke about. These are them. Okay. Now, we are into what we call, courses development. We have developed 64 courses to be mounted on the World Continuing Education Alliance. These 64 courses, we are still going, the review is still going on. 20 of them have been accepted, and 44 are yet to be accepted. So when we mount these courses, what it means is that you can go there, take courses, and you get your CPD points. So 20 have been accepted so far, 44 are still ongoing. And these are the areas of specialty that the courses have been accepted: pediatrics, emergency, women health, public health, and mental health as well. So these are the areas. And we equally have, so these are the courses for mental health. There are 4. Gambling addiction, those of us who are into gambling, you learn a lot. Then you go through it successfully. Then you make an attempt. When you get a certificate, you are through. Then we have childhood stress as well. Investing in your mental health. So yesterday, mental health was strongly spoken here. We invest in our mental health. You have to take those courses as well. And then mental health care in older adults. And so this is one of the links. I don't know whether I can, okay, let me see. It's not working. So we wanted to share with you an example of one of our courses that is accepted and to be mounted at the World Continuing Alliance. But then these are the areas that are still undergoing review. We have the medical nursing. We are developing 4 courses there. Surgical nursing, we are developing 4 courses. Infection prevention and control 4. Leadership and management, critical care nursing, oncology nursing, community and primary health nursing, geriatric nursing, ophthalmology nursing, ENT, and midwifery as well. So these are courses that is currently undergoing review with the World Continuing Education Alliance. The moment we are done, you can always log in, make an attempt, and when you are successful, but this is, let's take note, you can only make 5 attempts, and you must reach 70% before you are given a certificate by them. Then, within the year, somewhere January 29th, we also submitted a paper for publication. Work-related correlates of quality of life of nurses and midwives in Ghana. We did a survey, 3,200 plus participated. We have the data. We started the publication process. So this paper is currently undergoing review. We have been given feedback, we've made corrections, and we are hoping that by first quarter of next year, the paper will be out. So watch us and then take part of and read to understand what it is. Challenges encountered, limited capacity of Zoom link. Sometimes our Zoom link, you all know. Some of you will be insulting us. You publicize this. We were ready to participate. At the end, you embarrass us. We are sorry. We are sorry. But it's not easy. It's not easy getting a Zoom link of 1,000 plus. And it's always a big challenge. And the other problem is low participation in some webinars. Sometimes we had only 500, sometimes 800. So the maximum we always think is around 1,000. But if we are getting 1,000 plus all the time, then we'll be pushed to go to 2,000. Then difficulty in securing facilitators, especially our local facilitators. You see, the experienced nurses and midwives among us, they are either too reluctant to participate in our programs as facilitators, or they are not available. Despite the small tokens Madam President still give to them as incentive when they participate. And our platform is the biggest. Look at the whites. They are okay. All of them, they want to participate. They sent a name of 7 facilitators just for one program. But in Ghana, you chase all the professors, all the PhDs, and they'll tell you that they don't have time. Let's look at it. Those of us who have the capacity to be facilitators, take part. And also improve your CV. Sometimes when you say that you have, facilitated a national program of which 1,000 members participated, you put in your CV, it's a plus. And then the scheduling conflicts, the timing. Sometimes we don't know which time is convenient for everybody. Because of the shift pattern, you see that some people say if we can have it at 3 a.m., others say 3 p.m., others say 6 p.m. We don't know which is which. And we can't get one time, a suitable time that will accommodate everyone. That is not possible. So just bear with us. Then the way forward, as we enter the next phase of our mandate, the remaining 2 years, this is what we have. We want to finalize the CPD courses, the remaining 44, then we mount them on the World Continuing Alliance. In fact, Madam President, we also want to commission it. When the loan people were commissioning 400,000, people were jubilating. We will commission over 3 million words. And it's going to be worldwide. Oh, you won't clap for us. At least. And you use it to get your CPD points. So, Madam President, take note. We will come to you. We want to commission it. This is worldwide. And we will commission, I will personally count the words of the 64 courses. And I will share with you, and you see the difference between we and loan commission. Thank you very much. Then we want to continue capacity building webinars to enhance professional development. So the webinars will continue. We want to have one webinar per every month. In other words, 3 webinars per quarter. That is what we are sifting into so that we can learn a lot. We can satisfy the constitutional mandate of professional excellency. That is what we are trying to do. And want to strengthen collaboration with academic institutions and professional colleges across the world, not only in Ghana. As you can see, the whites are embracing us. All the consultants are there coming. And so we want to collaborate with them. Then we have 2 papers we want to submit. The other one we submitted on work-related correlates. This time we are going to look at demographic correlates of quality of life. In that study, we said, where do you come from? Are you a male or female? When we publish this one, we'll know whether if you're a male, you have access to quality life than a female. Or if you are from Volta region, you have less quality life compared to those of us in Upper East. You'll get to know. Is that okay? Good. Then we'll also look at socioeconomic factors. Socioeconomic factors of quality of life and work life of nurses and midwives. We'll publish that one too as well. So you will get to know all the socioeconomic factors. How does it affect your quality of life? Some of us, you put everything and say you are DDNS, yet you are still on loan. No car. The small car they talk about, you don't even have land. No Corolla. Exactly. So you see, so please, so we will take you through. When the paper comes, please try and read it and understand those factors how are they related with your quality of life? If you are in Greater Accra and your quality of life is not good, come down to Upper East. We don't have traffic, easy going, and food is cheap. Is that okay? Good. Then we want to acknowledge the National Executives Committee, especially Madam President. They have done so much for us as a committee. All the time we are always knocking at their doors. We want to also thank our Assistant Secretary and the General Secretary. All the time we are pressurizing him to mount it. In fact, and the PRO, National PRO, sometimes when there is a problem with our poster, he's the first person to be hit. They insult him, he has to withdraw and call back and say, you see what you have caused. Then I say sorry. Say, we are sorry. We will continue to be sorry. It's not easy. Is that okay? Then the experienced nurses and midwives, who come as facilitators, we want to thank you so much. You are doing so well for us. And we wish we always have you as facilitators. And all of us prepare. Every time I want to facilitate, you know why? For my CV. If I don't have money, I should have CV. The platform is there. Please make use of it. And our webinars participants, all of us who participate, you make it lovely, and we are grateful. We'll see you on dinner night.
Thank you so much, Education and Research Committee. Let's do it better for them. The next committee to present, please stand there for your group photo. The next committee to present will be Editorial Committee, and Socio-Economic will follow. Editorial Committee.
Obi ba mamio, Unity. Madam President, colleagues at the High Table Conference, we are so grateful to be here. We represent the editorial committee of the GRNMA. I am the chairman of the committee. My name is Joseph Wollimore Krampa. I double as the national PR of the association. I have with me my able secretary. Let me allow him to introduce himself well.
My name is Alfred Addy, the secretary to the committee.
Nasser Sopal, Anthony Sopal, a member to the committee.
I'm Prince A.K. Anaba, a member of the committee.
Thank you so much. We have 5. The 5th one is a lady, Sister Eunice Duffier. Unfortunately, she couldn't make it here. So these are the panel members that we have behind the committee. The committee is tasked to bring out what we do as nurses to the reading public and to our members. And we have certain things that should be standardized to international level. So it's not a small thing. To get this caliber of people to sit and look through scripts sent by nurses, and which should be approved before it is sent outside there, means you have the men to do the work. Please clap for them. And let me borrow something from the socioeconomic and what they just presented. The Assistant General Secretary looks like he cuts across everything. And he's there for quality of work to be done. And my secretary, I don't want to talk too much. He will be giving the detail of this thing for us. So, comrades, let's wait patiently as I invite my secretary. Thank you so much, Secretary. He has given me a little of his task to do. Let me do that. So because of which, we have 2 categories of, let's say, papers or journals that we bring out. We have our newsletters, which every month, ever since we were ushered in, and we started our work in 2023 March, we've never failed the association. In that March, from 2023, the whole of 2023, we had 9 newsletters, and in 2024, we had 12 for you, and even up to 2025, we have 10 for you, which is 31 newsletters ever since we were ushered into office. So I will leave my secretary to give you details of what we actually do. Thank you.
All right. Thank you, Mr. Chairman. All right. So for the administrative membership of the committee, we have, because of the Ghana Journal of Nursing and Midwifery, we have our president as the editor-in-chief. Oh, please, give it to her. For a journal to function, you need to have editor-in-chief. So administratively, she is the editor-in-chief. And then we needed a technical person who is also the managing editor. And he's not with us here. He is Mr. George Bene Mensah. So if you've been sending papers to us, you see this name. And pardon us for some of the reports and then feedback. It is just to meet the standards. So when I'm the editorial team lead, then we have the members there as stated by my chairman. Terms of reference: develop, produce, and oversee the publication of the Ghana Journal of Nursing and Midwifery. You can pick up your phones and Google search Ghana Journal of Nursing and Midwifery. You'll see what we have there. Facilitate the production of the association's monthly newsletters, as stated by our chairman. Provide editorial oversight for all GRNMA publications, ensuring consistency. So some of the things will be published, we will get to him, we take it down, we work on it, and then we resubmit. for accuracy and professionalism. Promote professional growth through platforms for academic writing, research dissemination, and knowledge sharing. So for this conference, we're also tasked to call for papers. We have done that. So going forward, some of us will be giving some update on what they submitted and have been approved. Ensure alignment of all editorial content with the association's vision and strategic goals. Our objectives and targets from our time of inception to date. To launch the GGMID, that's the Ghana Journal of Nursing and Midwifery, and establish online presence. Like I said, pick up your phones, Google search, and you'll find it. And please, let's applaud our president once again. I'll tell you why. Oh, please, let's applaud her. Ghana Journal of Nursing and Midwifery is the first of its kind, not only in West Africa, in Africa. A journal established, owned, and operated by a professional organization or a trade union. Not the type that people partner with universities and then the universities will manage for them. This is a journal that has been established by a professional organization and a trade union, and we are managing it. There is none in Africa, and we are receiving papers from all over Africa. And to add to it, President says for the first 2-3 years, we shouldn't take monies for article processing charges. It shouldn't be taken. Yeah. And to compute all monies that have been spent in publishing some of the works that you have submitted to the journal, we are a little over 250,000 Ghana cedis. The cost has been borne by President and National Council. So you can see that when you submit papers, it is free. But when you send to other places, 600 USD or 750 USD, this is going free for us. So please, let's take advantage of it. The third objective is to look at the international databases. For now, we have done 10. And members call before they submit paper. They are saying, I use Scopus index. I use so-and-so index. You need certain number of publications and the number of existence, number of years to be in existence before you get registered with them. So if you don't bring your papers to us, for us to have the right volume, for us to get to the point where we can apply to be part of Scopus, we can't get there. So do not sit back and say, I'm waiting when we get to that level before we submit the papers. No. Let's submit the papers. When you get to the platform, you will see the editorial board, very rich editorial board. So your papers are given rich assessments, please. So for Scopus, are we ready? 5,000 USD annually. That's the renewal. 5,000 USD annual renewal fee for Scopus. And it will make us richer. And then the last is to submit to the Directory of Open Access Journal. It's one of the databases that when you send GGMID to, it will work. And we have initiated the process. We have received feedback a few days ago. And what they are saying is that we need to complete our volume 2. We are done with the volume 1, so they want us to complete volume 2. And that will be completed end of January next year. All right, so for committee, for key activities and timeline, we look at the committee inauguration, and that was in March 2023. It's done. General lunch, that was in March, during our IND. During the IND lunch, that one was done, not January, it was done in March. So volume 1, we had 4 issues. It's quarterly. So March, June, September, and December. But the December always moves into January. So we do quarterly publications. So we are done with it. And we launched the compilation of the volume 1. It is live on the website. When you get there, you can download it. And copies of the books were sent to the regions, but download one on the website. Just visit the website, go to archives, and then you download. For volume 2, we have started. Issue 1 and 2 gone. We are working on the third issue and then the fourth. So those who will be doing their presentations, once you are through with it, we can capture you to be either part of the third or fourth, or you go to volume 3. So DOAJ application submission, like I mentioned, we have started the process, and we want to finish with the volume 2. Madam President, since our inception, we have received 79 manuscripts. We have published 34 of same, giving us acceptance rate of 43%, which is well within the standards, with 45 average days. Mostly when you send to the journals, it goes 60, 70 days, but with 45 days because of how quick we work on the papers we receive. And for the task you gave us regarding the call for papers for this conference, please, let's applaud President and her team. For the first time in our conference and Congress history, for the first time, we have called for abstracts for members to come and present something so that we know what they are doing. And please, on that, the originality of what they presented stood at 87.5%, which is very commendable. So by way of summary, volume 1 is completed, and then volume 2 is ongoing, international collaborations. We are receiving papers from Nigeria, Lesotho, US, UK, it's all over. The quality and the standard is top notch, and it is free for now, so people are bringing the papers. So we are working on same. For the newsletters, I'll skip that. Challenges, the risk. We still need more. You are doing a whole lot. You are sitting on the data. Please submit. We have an editorial board that will guide you to shape your work to the point where we will have it accepted. So please, don't sit on them. Submit them for us. Research ethics awareness. When we called for the abstracts, we realized something. So we have also quickly added it to our challenges. 12.5 plagiarism rate in conference submissions. 12.5. It is expected. So it is shaping the way we should also do our things. Peer reviewer capacity. You have a limited pool. So if your expertise is in that area, kindly reach out so that you support the work for us. So that even the average 45 days, we'll be able to even reduce it further. Financial sustainability, the ongoing cost for the database. Now, the system is on the free model, the open access system. But once we go to the Scopus and the others that we want to get there, it will come with some costs. So we have to look at all that. And it is free. But maybe once we get the numbers, we may change from free to paying something small. All right, so way forward. And then the actions. Completed the volume 1. So complete volume 2, that's issues 3 and 4. In charge is the editorial committee. So we are working on all this and all that. But Madam President and conference, we want to see whether we can launch, think about it, whether we can come out with a research award, something, just to also encourage authors who submit papers to the general. We also want to reach out to the regions, get in touch with your people, the educational facilities in your regions to help us to grow. Recommendations. Per our work, we recommend that we accept the original conference abstracts that went through successfully for presentation. We rejected one plagiarized conference submission. And to approve budget for 3 database index that will help us to work better. Invest in plagiarism detection software. This is not to say that we do not have. The managing editor is having one. That's what we are using. But we believe as a journal, we should have one on our own. So we are seeking for approval to invest in plagiarism detection software. Establish GGM-made Research Award. When I say GGM, that's a short form of the Ghana Journal of Nursing and Midwifery. Support editorial team capacity building. It's mostly training. And partner with nursing schools for submissions. And we will need you to help us in that regard. And then mandate research ethics training for presenters. Like I said, we have done it already for our president, the managing editor, and then to all the members of the editorial committee, thank you. And the technical and support team and then the peer reviewers, they've been wonderful, and we need to applaud them for that. Thank you so much, Madam President. This is by way of report from editorial committee.
Thank you, editorial committee.
Thank you, Madam President. Before perhaps we are giving the last applause, I would like to appeal to the regions. You see, he talked extensively on the journal. The data and other things are with us. Please, let's submit them. Aside that, the local things that we do in our various districts and regions, is OJ here, Volta Regional Secretary. I've been worrying him a lot. I think my PRO in Volta region too, I'll ask him, you are doing this, send us a report. We need all this. The activities that we do, aside the data that some are gathering for us, they are all part of what we do. And it makes the newsletter very interesting to see your district or something. At times we have to comb round. Nurse actually delivered somebody recently. We wanted a specific report from the region, but it was not coming. Later on, we have to rely on certain sources to get all this. These are all to our great credit. Please, don't let us sit down. If there's anything that you are doing in your day, send it to us. We will get it outside there. Thank you, Madam President.
Thank you so much, editorial committee. You can take your group photo and come down so that the socio-economic committee can take the stage. Socio-economic committee, I hope your slide is ready with the team. If it is ready, please project it.
If you give me benzo, I beg, give me long life. For me and you, baby, I day and night. If you say I'm a no be my might. I don't say one day we go die. But no be today, oh, why? It's all my die, we are no one, mamma, and no one I'm show. We don't have mamma, content. Papa, mamma, content. What I'm a sit down, mamma, and what that shock me, boy. And yeah, Papa, I beg you,
okay. Thank you, Madam President and delegates. This is Socio-Economic and Welfare Committee. We are made up of 5 members. And once again, my good self, Thomas Jeffo Lambon, the chairman of the committee.
Lawrence Bergman, the secretary for the committee.
Naulomo David Sam, member of the committee.
Mabel Kisu Asafo, member of the committee. Thank you.
Thank you. Socio-economic and welfare, we are for the general welfare of our entire members. And so your welfare is our concern. Madam President, let me put on record and tell Education and Research Committee that we are the matter of all the committees. Whatever you do, your welfare is in our hands. We care for you. We'll make sure you are fine and you continue to do the good job. And so, without much ado, I hand over the mic to my dynamic and very calm secretary to take us through. Thank you.
Thank you, Chairman, for the opportunity. Madam President, permit me to stand on established protocol to make the presentation for the Socio-Economic Committee. We are continuing from where we left off yesterday, and then to introduce the other things we are doing apart from the health fund. So on your screen now is the membership as we have been introduced. One of us is not here, but we are together. The terms of reference, we are supposed to draw the attention of the union on welfare issues of members. So that's why my chairman is saying that we are the mother of all committees. And then even at the place of work where we have abuses, neglect, discrimination, and unfair treatment of members, we monitor all that. Then we make recommendations for donations and gifts of members, and any other activity that the union will be interested in. So our scope of work is, as we can see on the screen, so we monitor ill health, death, celebrations, natural disasters, benefits, etc. I'm not going to explain this thing. This is just a summary of what we presented yesterday. Now, let's look at mortality. The fact that we are dying in active service. All regions have reported some deaths. For the past 2 years, we have recorded 107 deaths of nurses and midwives in active service. In fact, the data is more, this is just what is reported. And we are also still encouraging regions to make sure that we report any death. Because what can kill a nurse, what can kill a midwife, can kill any of us. So we should be interested in what kills us and take measures so that we can stay alive to enjoy the fruits of our labor. The youngest person that died within the period is 26 years. The oldest person is 59 years. Just imagine, just before retirement, then you are off. If you are a youth here, there is no good news for you here, because the average age of death is around 36 years. So it means that the youthful population are dying. The modal age is 35, and then the rest, as we can see. Madam President, we may need to give some special attention to Eastern region, because the majority of the deaths are coming from, per the reports, Eastern region. So if you submit, I think so. I think so. But we can also use the opportunity to give Eastern region a preference, because it means that if we get health fund application from 2 regions, we should give more attention to Eastern region. So these are some other mortality indicators. Check the sex composition, male and female. We have 65 people dying from females, and then 40 males. But check that of northern Ghana. All the regions, you have more females dying, except in northern Ghana, where you have more males dying. So my colleague Nordness, we need to go into caucus and learn some lessons. What is it that is killing us? I also want us to take a look at the professional groupings. I am sure that many of us will be thinking that because enrolled nurses are more, they will be dying more. Unfortunately, it's rather the registered general nurses who are dying more. So let's, the specialized society, look at it. I'm not sure the data is telling lies. Let's look at it. Then what is worrying is that majority of the deaths are not, autopsy is not done on them. So we are not very sure whether even the data we are looking at is the correct cause of deaths that we are looking at. So this is how the mortality chart is looking like. Now you can see that the cancers are leading, and it is widespread in many of our regions. Maybe if we were to have all the deaths going through autopsy, I am sure that we're going to have more confirmed. So what is also worrying is that many of us are dying from conditions that we don't know the cause. And so we want to still plead with GNMA leadership. Wherever you are and there is a death, let us try to make sure that the death goes through autopsy so that we know the true cause of death, and for us to learn some lessons from them. Now, look at the 13 critical illness and the mortality chart. Are we seeing anything different? They look exactly the same, not so. So that's why we think that if we skewed the health fund application towards this, then we will be saving a lot of lives. So I think yesterday somebody was asking whether it is comprehensive enough. So it is. We have actually studied the mortality pattern and then the mobility pattern, and they all resolve around the 13 critical illness. Madam President, the abuses, neglect, and discrimination is one of the thematic areas that we don't have any data at all, because regions have not reported. These are the things that must come from the facilities through the system to us. We want to know even issues of harassment, physical, emotional, sexual. We know that they happen, but we don't have evidence as to what magnitude of them that happen. So we are encouraging the focal persons and regional and district reps to get us some data so we can learn some lessons from them. Processes of benefits to members. So for the period under review, we have processed death benefits, spousal, retirement, surveillance, life members, etc. So the data we have is as follows. Now you can see that the death benefit that we have prepared is in the up to 71. So it means that there are still some unclaimed death benefits. So we want regions to check those that have not been processed so that we can process them. Now let's look at the data on retirement vis-a-vis life members. So far, it's only one region that we have a life member coming from. You know, the life members are supposed to be from those who are on retirement. I am sure we have processed a number of them, but our data has only captured one for the 2 years that we are reporting. And let's see the details. So these are the benefits that have been claimed already. I need to add that the claims are up to the second quarter of this year. So third and fourth quarter have not been processed yet. So it's most likely many more will come. In the case of the life member, it's only Greater Accra that we can have we have one person on our records as having process. The spousal, we have as many as 54, and retirement as many as 357. The regional distribution is what we are seeing on our screen. Now, I want us to look at this point. These are all people who have left us as an association. Some really do not belong to us at all, but some belong to us but have changed profession. And I'm sure that as part of our membership drive, we need to add counseling to our junior colleagues. Because once you go and do a course outside the nursing rank, we are likely to lose you. And there are the people who apply for change of union, and it will reduce our numbers. So there is something we could have done in the case of the 689 people who left us. So we are tasking members to speak for the union and get our people educated before they go in for courses that will take them out of the professional ranks. Axis Pension has been paying, and then this is how much individuals have received. The highest so far is about 21,000, and I'm happy to announce that this person is from the Upper West region. Why am I singling it out? The person is a retired district director of health services. We're having many of our colleagues who are district directors switching to Health Services Workers Union because of fuel allowance. This person remained and is so far claiming the highest so far. So we should send this message to our senior colleagues so that they don't get lost. Now, within the period, we have also realized that there was a need to satisfy all our leaders across board. Because you are here as district chairman, regional chairman, one day you are not there. You make a position that maybe you put it in your CV that you were a district chairman from this to this period. And then they ask you for evidence. You don't have it. So the committee decided that we will give certificates or documentation to every leader from national to the grassroots. What we have not done is in the case of facility coordinators. Maybe going forward, we will have to explore that. So the numbers you are seeing on your screen is the numbers that we have been certified, including specialized society executives. Now, these are evidence of what we have given to the 2020-2023 batch of leaders. So those of us who are currently leaders, be rest assured that when you complete, we will give you a documentation of your work done. Now, this is results of screening we did for the guest house workers. And we want to use this one to encourage all regions. The people we are keeping, we need to screen them and know their status. We also want to use this to appeal to leaders here. When you go, insist that the facility screen our members so that we know, so that we can identify those who have conditions early, and we can pick out those who need health and support so that we can attend to them quite early. Now, as part of our assignment, we take on special assignment from the National Council. Within the period, we had people applying for health fund for addiction, maybe pethidine or alcohol addiction. Then we realized that the moment you give any financial support, it may make their conditions worse. So initially we rejected them. But later on we realized that these are our members. One day, if the worst happen, it is still our profession that will be singled out and mentioned. So we made a proposal to look at how best we can help them. And so we went through, identified some rehabilitation centers, and screen them to see how we can engage one of them. So the facilities we are seeing on the screen are those we engage. These are evidence of our availability, our presence in those facilities. At the end of the day, we assess the care components, the service cost, the average cost or duration of care, then the quality care indicators, and the readiness of such facility to enter an agreement with us. The Pantine Psychiatric Hospital came top. And so we have since recommended and adopted the Pantine as a rehabilitation center for nurses and midwives who have issues with addiction. Now, what is the process? If you think that you have come to the point that you think you need help and you want to go through rehabilitation, so you apply normally like any other health fund application, then you send the application to us. We'll assess it. If you qualify, we'll ask you to go for assessment. And then you generate the invoice from there and send it to us as a backup. Now, if we approve of it, then you go for admission. Then we'll submit the check to you while you are on admission, so that we don't hand over the check to you while you are at home, because that one will be dangerous for us. Now, so that was done, and that is the arrangement that is being run. General recommendation, we still think that we should monitor how the employer is treating us, especially in our work within the teams, and then report same, and use that as points of engagement during the condition of service negotiation that we may embark on. So next step, so the next 2 years, what are we going to be doing? Apart from any other assignment that will be given us, we are looking at the fact that the nursing care is introducing home nursing from next year. So it means that people will have to move from home to render care. So the question we're asking is, what value are we placing on ourselves such that we are not exploited? So we want to work with the specialized groups and put value on each and every nurse so that we publicize them so that any individual or company or group that is interested in the care of a nurse at home, you don't go and you are negotiating. The price is already known so that you go and engage. So specialized group will be engaging you and then taking your views on that. The second thing we want to do is to look at how we can collaborate with government and make use of government policy. You know, there is affordable housing scheme now. We all know that we all have land projects within the regions. The government is saying that they want to enter agreement with unions and see how we can get accommodation. So we already have the land. So we want to see how we can engage government to see if it is practicable. They can build for us and then we pay back in years. So that by the time we go on retirement, our housing provisions will be sealed. If not, you know, it's one thing acquiring the land and another thing building. And what we had, the project is able to put up the building in just 6 months. So assuming that in 6 months you have a house, then you can use some 5 or 6 years to pay off. You can actually even use the rent, depending on where you are, to pay off the house. It means that you would have been able to build without even using your own money to build. That is what we want to also push in the next 2 years coming. We want to add that the Socio-Economic Committee is not just the 5 of us you are seeing, but every region we have a rep. I don't know whether we have the reps available. The names we are seeing on the screen are those. Can you give us a wave if you are around? Yes, so every region is represented. The reason you are seeing the Upper West in red is that he is actually a replacement for the person who was formerly there. The 2 devs that Madam President showed, the second person from our region was the focal person until his death. So the regional treasurer has since taken up that role, and we take some data from them. Within the period, we have designed some tools to help us collate this data. So the data you are seeing, it is an active process we use to source them. So we have a mortality reporting form, we have a welfare data collation form, we have the health fund application form, and we have the membership exit form. So please, you need to look for these forms anytime you need any of these services and apply so that we can process them for you. Our deepest appreciation to Madam President, who has been very supportive to the committee, National Executive Committee, we are grateful, National Council, all sister committees. There is no committee that can work alone. You work in collaboration with other committees. We are grateful to all of you, and by inference, this conference, we are grateful. Thank you very much.
Thank you so much, Socioeconomic Committee, for that report. Please take your group photo so that the Building and Construction Committee can also come upstage.
So, Madam President, I just want to say something about the picture we are seeing on the screen. This picture was taken at Ankafo Psychiatric Hospital when we went to do the assessment. When we got there, there were these students who went there to do their clinicals. Then we realized that there were potential members. So we decided to engage them and told them about GRMMA. Technically, GIMTA is under youth committee. We are just sending a signal that don't say that you have a scope of work. Whenever you come in contact with a potential GRMMA intervention, just do and report. Because we are getting so many people getting to identify problem and come and report. Let us not be reporting problem, but interventions. Thank you very much.
Thank you so much.
Madam President, your kind permission, just a bit small emphasis on the rehabilitation, because that's we just started. The rehabilitation, as you rightly described, we are not entirely or totally responsible for the cost of rehabilitation. We are a part, we are a third party. The responsibility lies on the employer and the family, as well as the person himself or herself. Have to take that, and we come in as a third party to support. So when you go there, and whatever costs they give to you for 6 months, when you send to us, whatever we give to you, it is what we can afford, or we can help you. So let our members who are into this get to know. That is not as if you go and pick every cost and come, that GRN has said they will pay everything. No, it's a responsibility for all to share. However, we don't give the support to them. We rather get what we are going to support, we pay to the hospital account. If the person decides to run away, you will not get anything. So the best is to stay and go through, and you have your life back to normalcy. Thank you, Madam President.
Thank you so much, Chairman of the committee, for that clarification. And thank you for your report. Building Committee, can we see you upstage? And please, media team, project their presentation.
And they call me Eugene. Oh yeah, yeah. Say me why, no Indiana, yo. Say me why, no would do ya come yo. I don't say me why, no best me. No best me.
Unity. We are 4 in number. The man sitting there is Ibn Samba. He's an occasional acting chairperson for this committee. Occasional. And also secretary for Upper West region. Esther Brickland, the secretary for the committee, and also chairperson for ENT Society. I'm the chairperson, Daniel Atetufo, aka Ofata. And also the second vice president. And also the family head of the family of Jeremy, family of alopecia, which Chairman Lassa is the prominent member. Chairman Abiu, Jeff, Wujiti, they are all family, very important family members of alopecia family of Jeremy. The occasional acting chairperson will come and give the report for certain reasons. And I want to say something about the National Headquarters Guest House before he comes in. The occupancy is 30 rooms. And because of the location, everybody wants to go there at any given time, because when you are there, you are easily accessed to wherever you want to go. And the National also have programs where we invite people to come and stay there. So the complaint of we are not getting room, yes, sometimes you are right because of certain background checks that you do. But we still want to appeal to you that it's a challenging place for all of us. Sometimes some of us, if you are not lucky, you will not get a room. I remember former first vice, Mr. Cosmas, has ever gone there and didn't get a room. Sometimes very challenging, so bear with us. As we keep bidding, maybe a time will come that every region will have 2 guest houses or hotel. So, occasional acting chairperson. And then the fourth person is Gloria Bosu. She could not make it. In fact, I do occasional internal promotion in my committee. So she is not just a member, she's a senior member of the committee. Yes.
Okay, thank you very much, my chairman, and thank you, Madam President, for the opportunity. Good morning to the House. So, like you said, my name is Ivan Sibin Samba. So I do this presentation on behalf of the chairman, who has just addressed us. So the picture there tells the story. That's the chairman and the building behind him, the biggest building we are embarking upon now. So these are members of the committee. Their names are there, we have been introduced. So the presentation outline, we would look at the committee's terms of reference, objectives and targets for the period under review, key activities. We look at regional hostels, guest houses, and hotels. We look at the headquarters project, Cape Coast Conference Hall project. We look at achievements the committee had within the period. We look at some challenges we encountered, recommendations, way forwards, and conclusion. So the terms of reference, the committee assesses needed or maintenance and repair needs of the association buildings across the country. It monitors and supervises all buildings and construction projects of the association. It also recommends and makes proposal for consideration by the National Council for the acquisition of land and other immovable properties. Upon inspection of the works done and if necessary, the committee reviews all payment certificates submitted and report on same as deemed appropriate to the National Council. The committee is also responsible for ensuring the buildings of the association. The objectives and targets for the period under review, we sought to annually visit and assess all hostels and guest houses of the association across all 10 regions. And the status is that that has been done, and the report has since been submitted to the National Council. The committee also sought to put measures in place to monitor all ongoing projects of the association. And here, emphasis is on the Cape Coast and headquarters projects. We also undertook some repair works in selected guest houses across the region. The committee also sought to make recommendations for land and other immovable properties for consideration of the National Council. And here, the Ebri and Medina sites for proposed hospital projects were visited and recommendations made to the National Council. The committee also engaged NEC on the insurance of the buildings of the association. And I'm proud to report that all the hotels and guest houses of the association are currently under comprehensive insurance. Key activities and timelines. One, we attend monthly site meetings of the headquarters and Cape Coast projects. And that construction work is still ongoing, and so even in come next month, the committee would be in Cape Coast again. We'll give you details of it as we proceed. Then we also visited selected guest houses across the region. Usually, we receive reports from the regions in terms of identified defects relative to the guest houses. So once that is done, so we visit there, assess, and produce a report to the National Council. Then the committee also submits quarterly reports to the National Council, as all committees do. So let's look at the regional guest houses. Because this is a conference, we think that it is important that we remind ourselves when these guest houses were established, and to some of us, where are they even located? Then what are the facilities associated with them, particularly conference halls? Some of us, we stay close to these facilities. When we have programs, we are not even aware that our own backyards, we have these. So we decided to emphasize them on this occasion. So the Upper West Regional Guest House was commissioned in 2013, located at Napogba Kole in Wa. It has 32 rooms and conference hall capacity of 250. Upper East was commissioned in 2023, located at Pusu Namongo. They have 1 executive room and 27 standard rooms. They have a conference hall capacity of 500. The Northern Regional Guest House was commissioned in 2021, located at Vitin, Tamale. I think we all reported there to be taken to this place for this exercise. They have 4 executive rooms, 26 standard rooms, with a conference hall capacity of 150 to 200. The Burahafo Regional Guest House was commissioned in 2019, located at Isufufu in Sunyani. It has 2 executive rooms and 30 standard rooms. Conference hall capacity of 350. The Ashanti Regional Guest House, commissioned in 2017, located at Ijisu Krapa. It has 2 executive rooms and 25 standard rooms. Conference hall capacity of 350. The Volta Regional Guest House somehow never saw any commissioning per the records. It is located at Godokpi Junction off the whole Polyclinic Road. It has 2 executive rooms and 28 standard rooms. Conference hall capacity, they have 2 conference halls. You remember that the facility there was started with a conference hall, and so when the guest house or accommodation facilities were added, a second conference hall was constructed. So they have 100 capacity and 200 capacity conference spaces respectively. The facility currently has some issues that National Council and NEC have been discussing. I think some interventions were made there recently, but they still talk about electrical issues, plumbing, and some glass works. The National Council and Madam President are looking at that. The Eastern Regional Guest House was commissioned in 2010. Unfortunately, we didn't get the other details. I think we'll update that later. Western Regional Guest House commissioned in 2021, located at BA 209 Pacific Avenue off the Nkrumah Kasa Wurodru double road. It has 2 executive rooms, 7 semi-executive, and then 22 standard rooms. It has a conference hall capacity of 250. Central Regional Hotel, commissioned in 2020. We couldn't get the other details. Maybe a discussion, they will come up. Greater Accra Guest House was commissioned in 2015, located at Kolebu along the Zoti Link Road. It has 10 executive rooms, 24 standard rooms, and they have 13 twin bedrooms. It has a conference hall capacity of 250. The national projects. So here we want to zero in on the headquarters project and the Cape Coast Conference Hall project. The headquarters project is a 7-story building named the GRNMA Star Hotel. It is situated just behind the National Secretariat building. It comprises 165 rooms. Some are executive, semi-executive, and standards. I think the fine classifications would be done when the facility is completed. It also has 3 conference halls, a restaurant, and a sky bar. As at today, all block and plastering works have been completed at 100%. External cladding works is about 90%, as we can see in the photo. Yeah, so please take note of that. And then this, that is the artistic impression. So that is where we are driving towards. So if we are already here, it means that there's a lot of hope, isn't it? So you can clap again for Madam President and the team. So this is on ground, but we are working towards here. All right, so if you are familiar with the area when it is completed, you should see from the association's site, the GRNMA's, the association's building site. This is how you would see it, the main entrance. The front view. Yeah, front view. Thank you, General. Then we are also bordered by Waik. So if you are viewing the building when it is completed from the Waik end, this is how you would see it. And it would look like this from the NMC end after completion. Now, for those of us who would be viewing it from the airport area, this is how we would see it. The General Secretary says I should call it back view. That's how we would see it. So in terms of the headquarters project, that is where we are on it, and we are hopeful that before the close of 2026, we should be able to actualize all of these. Now, the Cape Coast Conference Hall project, it is the biggest facility within the central region once completed. It has a potential capacity of 850 to 1,200. As at the end of October, the entire facility, when I say the entire facility, It includes the block work, tiling. In fact, the structure itself is done. The major thing left is the landscaping, which has also started and has progressed steadily, and then furnishing. So when you put all of that together, then we say the facility as at the end of October is 75% complete. Hopefully, we expect, I think like Madam President announced to us, by the first quarter of 2026, we should have received that facility in our custody. This is not current. It is just for us to appreciate where the facility is and how it looks like. We have since progressed beyond this. We have even progressed beyond what we are seeing now to something like this. That's where we are. So this is the front view. Then the landscaping, so we can see that some leveling is ongoing there. We can see some green grass and all that. Maybe this is even clearer. So hopefully, I believe that by January, February, we should have this facility. Now, what are the achievements of the committee within the period? The committee has been able to represent the association at all site meetings of both the Cape Coast and headquarters projects. We have been able to establish effective communication channels with key stakeholders of all ongoing projects. And this has improved oversight and overall good progress of work. The committee conducts regular visits and assessments of selected regional guest houses and made recommendations to the National Council for Intervention. It has also made recommendations for possible acquisition of land at Ebri for a future GRNMA hospital project. What have been our challenges? Limited expertise in building and construction. Then time. You know, we are nurses like all of us in this room. So sometimes at the beginning it was not easy. You go and sit there and they are using some of the technical jargons. When you ask questions, it's as if you want to drag everybody. So it didn't deter us. We had to devise, a plan B to be able to meet some of them. So we took note of some of the technical jargons and also engage experts prior to every site meetings. So it enhanced our contributions at these meeting places. Recommendations. There is the need for some capacity building for members of the committee in both building and construction and monitoring and evaluation. And probably we will take advantage of the presentation made by PPME yesterday, and we enroll on those short courses to enhance our knowledge. Then we are recommending to the regional guest houses and hotels. We know that we are already doing this, but just for emphasis, that in recruiting staff, let us pay attention to persons who have the requisite expertise to be able to man these places. Because we are putting money there, it should be able to give us the needed dividends. Then staff should be given KPIs, particularly the managers, to work with under defined terms of remuneration. Now, we have also observed, having gone around all the guest houses across the regions, the fence walls that were initially constructed before the buildings were established, they are that short. And so the guest houses have issues with tourism authority in terms of security. I think some regions have made effort to fence them with barbed wires. I think Ashanti, also that's the one I can easily remember. So we are recommending that all regional management teams should make this a priority. The members should be educated on the need to book rooms ahead. My chairman spoke about the complaints and challenges we have had, particularly with the headquarters project. The National Secretariat building. The rooms there are just 30, and where it is located, that is the headquarters of the association. So at every material time, we have activities ongoing there. Then these days, because of the migration, a lot of our colleagues, either they are traveling in or they are going out. So they all book there. So when you go there and they say there's no space, let's understand. Recently, I had an experience where a very senior colleague of ours booked the Zoti facility and arrived at the headquarters. Then they said there was no space. He wouldn't understand it because it's GRNMA facility and he has booked, he's a member. So he called me, I said, no. Where did you book? He said he booked online. The headquarters, we don't do online booking. Then they said he should go to Zoti. He said he had no means to go. You know, at the end of the day, I think he sorted himself out with some nearby facility. So let's try to avoid these inconveniences. Then future plans, the committee recommends should include a new guest house facility to replace the WA and Eastern Regional guest houses in line with the GRNMA's dream. Way forward, the committee would continue to collaborate with the structures of the association in carrying out our mandate, then to collaborate with the PPME in inspection of regional guest houses and monitoring tools. We are aware that the PPME committee comes around, I think, twice yearly to conduct their assessment. So we are thinking that we should be able to agree on define tools that they can come with and maybe conduct some assessment for the building committee to avoid needless duplications. Then the committee hopes to continue to monitor and supervise all ongoing projects to ensure they deliver within schedule. And in conclusion, we remain committed to serving the association's interests at all times. And we shall continue to monitor the current buildings and supervise all other associated projects. By way of acknowledgement, we want to say we are grateful to Madam President and the National Council for the opportunity to serve. Individual members of the committee, like I said earlier, also identified persons with expertise in the area of building and construction who provide some technical guidance to enhance our contributions at site meetings. We are grateful to such people. These are photo gallery. So the Western Regional Guest House, that is it in pictures. We have Cape Coast Hotel. Then this is Ashanti region, Northern, Upper West. I'm sure you understand why the committee is making the recommendation for a major intervention there. Bra Hafo. This is the Eastern Regional Guest House. These were constructed very early. Reverend. Upper East, then Greater Accra. Yeah, so these are photos of some of the site meetings. All right, so thank you very much.
Thank you so much, Building and Construction Committee. You can take your photo and give the stage to the Procurement Committee. Procurement Committee will be followed by PPME Committee. Procurement Committee, please go upstage.
Ever since I left you, I've been to hell and I'm back. Oh my baby, I wanna give you my body and soul. In fact, I want to give you the keys to all that I've got. Oh my baby, you are my rainbow. Now you done make my heart go chinkelele, chinkelele, chinkelele. Now you done make my heart go chinkelele, chinkelele. Can we run away? Can we run away? Yeah, can we run away to a special place? So be it all I don't be. Hey, as in my world, knock on your door. Oh, into so me move, yeah. No, I don't decide to Sanka mi odo kapinta Mema wakuma bakuncha Namamba we husenya Make on it tiraba Ebu boba kuncha.
Thank you, Madam President, for So we are presenting on behalf of the Procurement Committee. Our job essentially is to ensure that we get value for money for our procurement processes. I'm the chairman for the Procurement Committee. My name is Moses Robertson. I'm the National Treasurer. My committee members are here.
Thank you, Chairman. Please, my name is Patrick Tete, the Regional Secretary for Ashanti Region and the Secretary to the committee.
I am Squadron Leader Bess Makasari, part of the committee.
So I give the opportunity to the committee secretary to present the reports.
Thank you, Chairman. Thank you, Madam President, for the opportunity. So I take you through the Procurement Committee report for 2023 to 2025. And our presentation outline will be the introduction of the committee, which has been done already, our terms of reference, our priorities for the year under review, the activities, challenges, recommendation. Committee members, as mentioned by my able chairman, there we have one lady who didn't join us today, Ms. Rita Donche. She's a member. She couldn't join the conference this year. Our terms of reference to advise the association on procurement matters, to also develop proposal for procurement plans, to ensure the execution of procurement plans, and also to maintain a register of suppliers, and also work, but in tangent with the tender committee and the tender evaluation panel, which shall be appointed by the National Executive Committee. Continuation. So these were our priorities for the year under review. To solicit for procurement needs of the association, to develop the annual procurement plan, to equip committee members with the required capacity, to organize procurement training for executives at all levels of the association, to ensure smooth delivery of souvenirs to members at Kwesa Health facilities. Continuation of our priorities. To also conduct comparison shopping, to make informed purchase decisions, to institute an opinion pool on selected souvenirs by members using the Infonet, and also to purchase motorbikes for our newly created districts. So the activities that we embarked upon during the year under reviews, with its status, whether completed or ongoing, are: 1, to review the association suppliers register, which is 70% completed, and also meeting with the finance committee to build a robust supply register is yet to be initiated. So right after the completion of the review of the suppliers register, which is at 70%, we will engage the finance committee to build a robust supply register. Then to purchase a bed linen, towel for the National Secretariat. You could remember that some of us, when you go to the National Secretariat, there were shortages of the towels and other linens, and we've embarked on the procurement process, which is awaiting delivery from the procurement officers. And also to procure conference materials for the 19th Biennial Delegate Conference, which has been done successfully, and all conference members have received their packages. So the continuation of our activities under the year, to also initiate an action towards procurement of 2025 souvenirs, which is 70% completed. So we are hoping that by the end of this year or early first quarter 2026, the items that had the majority selection on the Infonet to be procured and delivered to all members of the association. Then assessment and determination of the maximum and minimum stock levels and stock quantity. So we did this exercise to prevent wastage at the National Secretariat, especially the guest house. So we needed to know the maximum level of stock that is needed at the Secretariat, especially the restaurant, so that at each quarter we will stock them with the maximum or the minimum amount of items that they need to prevent wastage. It has been completed. Then to develop and circulate a template for procurement plan. This has also been developed. Going forward, all the regions will have it. So this will have the item to purchase
the procurement method that you use, whether sole sourcing or other ones that we have, the date of procurement, the date of expiry of the item, or whether you need a servicing, all these are included in the template. It has been developed and completed. Then also to purchase motorbike for newly created activities. Process not initiated. So going forward, we plead with the National Executive Committee and all relevant stakeholders so that this can be done for our newly created district. To also conduct comparison shoppings to make informed purchase decisions. That's the window shopping. You go through other shops to make inquiries on the pricing so that it tells you what or which of the shops is having the best price. Then to also conduct a training for committee members and executives at all levels, district level, regional level, and national level, so that we have much knowledge in procurement activities. Our challenge for the year under review, the first one is non-use of the Infonet in the distribution of souvenirs in some regions. So that's the last, during the cloth distribution, we realized that most of the districts and the regions did not use the Infonet. So at the end of the day, majority of the members will be coming that they didn't get the cloth. Meanwhile, they distributed to people while they didn't even use the Infonet. So it has to, the National Treasury has to deliver additional cloth to such district, which was a major challenge during that time. Then interregional transfer at the time of souvenirs distribution was also a major challenge during the year under review. Then the non-regional segregation of non-controller and accountant general staff, especially the Quasar facilities, some regions, they have not imported them onto the Infonet. So during the distribution of souvenirs, there was a major challenge at that time. And the stagnation of our membership growth. You've seen that over the years, we are hovering around 90,000, 97,000. Meanwhile, there have been a lot of employment and recruitment of our nurses and midwives, but still there's stagnation in the membership. And you know, and the membership increase, it reflects in the amount of money that the association will also get to procure the items that we need. So these were our challenges for the year under review. So what do we recommend? We recommend that there should be a capacity building for procurement committee members and other officers of the association. Then regions to also ensure strict use of the Infonet going forward so that these challenges will no more be in existence. Then the purchase...
Please keep quiet.
We also recommend that the vehicle for the 2026 National Business should be purchased early so that the cost can be reduced for us. Looking at the exchange rate at the moment, I know that the previous ones, 2 of the vehicles were purchased at the same time due to the exchange rate at that time so that we can save cost. Then we also recommend that, Madam President and the House, there should be procurement for a new motorbikes for all our newly created districts across the regions. We also recommend that we should institute a mechanism to have one point of payment at the National Secretariat restaurant. Then engagement with all suppliers of the association, which will be done after review of our supply register. We hope that we will also embark on that exercise. And also interregional transfers should be done early before the start of our souvenirs distribution. So we employ all regional executives, district executives here so that we get the data, then you import all the members from other regions before we start sharing the 2025 souvenirs to prevent these challenges from reoccurring. Madam President and Conference, we are grateful to the National Executive Committee for their support over the years. Then we are also grateful to the National Council and all the general membership for their support. Thank you, Conference. This is the end of the presentation.
Thank you very much, Procurement Committee, for making the presentation brief for us. You can take your picture now. PPME Committee, please come upstage. PPME Committee, please come upstage. Media team project their slides. Thank you so much.
Good afternoon, conference. Sometimes the psychologists encourage us to use imagery fantasies as a way of distressing. Yesterday, you observed that we're in Washington. We enjoyed our flight in Washington. We just arrived. So welcome us. Go here. Go here. So, Madam President, we thank you for granting us the opportunity to make our presentation. And I will want us to, yesterday we introduced ourselves, so let me mention that we have Courage, Arnold Yao, it's not Kwashiga, don't add Kwashiga. He's the secretary to the PPME committee. We have Joyce Apao Mawina, who is a member. We have Shadrach Atakora, who is also a member. I'm wondering who has kidnapped one of our members. Please, if you know you've kidnapped Rebecca Okraku, release her to join us. Tamale Squad, search for her for us. Okay, so we're going to give you a brief presentation on our activities within the year, the period under review. And I would like to hand over to the secretary of the committee to do the presentation, and we'll be available during the discussion time to have questions answered. Thank you.
Thank you very much, my ever hardworking chairman. So I'm making the presentation on behalf of the Policy Planning, Monitoring and Evaluation Committee. So this is the membership of the committee. The chairman is a member of NEC and also from the Northern Region, secretary from National Council, Volta Region. Rebecca is from the Western Region. Shadrach Brongahafo. Then Joyce is with the Pediatric Nurses Society and from Central Region. So the team. Now, our terms of reference. We are to plan policies for the association, periodically monitor and evaluate the implementation of these policies, carry out reviews of policies, then review employment policies as it affects members of the association, and periodically monitor and evaluate towards ensuring sound employer-employee relationship. Now, what are some of the policies we've been able to work on so far? Before this current committee took up, the previous PPME committee did a wonderful job by drafting some committee. So this current committee also looked at some of those committees and also drafted some. So these are the policies so far we've been able to finalize. The socioeconomic policy, procurement policy, finance policy reviewed, building and asset management policy, transport policy, youth policy, the policy planning, monitoring, and evaluation is a policy itself. Then media policy, when it comes to our GRDM media and our social media engagement, how do we go about all these things? We've been able to work on this. We've done some reviews of the disciplinary policy, education and research policy, the loans policy, health fund support policy, conditions of service negotiation policy, booking and reservation policy for our hotels, then codified hotel management policy. Others include an operational manual for the hotels as to some standardized things that our hotels should be doing or to be putting in place. Standardized template for budgets, criteria for best nurse selection. And this is important because at a point we realized that every region were using their own criteria during the selection of the regional best nurse selection process. And so the PPME was tasked by Madam President and National Council to develop a selection criteria that will standardize the selection across all regions. And then the National Selection Committee would use the same. We also so the previous committee worked on some bylaws, a draft bylaw for the specialized, which is just a standardized one that they were supposed to adapt it to their works. So we are currently in the process of collating those bylaws. Regional assessment and monitoring visits, it's also one of the activities we undertook. Writing for grants and proposals for the association. Yesterday we presented on the University of Washington program, the short courses. Other standardized forms we've worked on is room inspections checklists, standardized assets register, and this time our assets register comes with cost valuations and also the depreciation, year-on-year depreciation percentages, so that we'll be able to know when we can dispose of certain assets, cleaning schedules, appraisal forms, and leave forms. Work in progress. Those that are still work in progress, we are employing people and we are managing people from time to time as a union, as leaders. And so there's a need for us to have some key policies like sexual harassment and employee support policy. Is currently in progress and we should be finishing it by first quarter of next year. What we have, if you go from one region to another, we all have budgets, but we don't have a standardized budgeting template. If you go to every institution, you must have a standardized budgeting template where there are key item areas that you budget around year on year. And so we are working with the finance committee to be able to develop that. The review of the 5-year strategic plan, which was presented to you yesterday with the help of the consultants. We are also working to fully operationalize the GRNM mall, which I'll come back to later. We've also worked on high purchase and GRNM mall policy. We are currently working to review the loans policy to reflect its current state and the role of the loans committee. Some key things under consideration that we are yet to delve in fully. We want to work on a green transition policy that would help us to score carbon credit points, that we can be able to get some of these climate change grants to be able to undertake certain activities as a union, get into partnership with Ministry of Work and Housing, together with the Socio-Economic Committee for a housing scheme at Pokwasi, then consider some health campaigns for the association, reviews the standard reporting format for specialized groups. Then we are hoping to do, together with the Education and Research Committee, some retrospective study or review of cost of debt for our members to be able to inform policy decisions. Also, as part of our activities, we carry out reviews. We do evaluation for all the activities we undertake, like the International Nurses Day, International Midwife Day, the Youth Day or Youth Boots Camp, then a National Awards Night. These inform progress that we make from time to time, or the association makes from time to time in some of these events. And so when you get the links for these events, the day-by-day links, please treat them as very important and complete the evaluation links for us, because it helps to improve. We are also trying to work with the specialized societies about issues regarding HEFRA. For instance, a nurse is not allowed to own, like maybe an ENT nurse or an otolaryngology nurse specialist is not allowed to own his or her own facility and all those things. We are working with the specialized societies to work with HEFRA so that that recognition can be given because at some level, especially at the specialist levels, that autonomy is provided under law, and so they should be granted. Now, so from every year we do regional assessments. We do the assessment twice a year. The first one helps us to collect a baseline data on the status of the regional secretariats and the regional administration. Then between October and November, we do the second round of assessments. And from the beginning of the assessment, I think for 4 years continuous, Central Region came out best as the best hotel. Last year, National Council took the decision to do the best administrative region so that the focus is not only on the hotel, but issues concerning how we run the regional secretariats, members' welfare, and all these issues. And Volta was adjudged the best region. Now, some key issues we pick from the regional assessments. Regulatory issues. Some of the facilities or some of the regions have still not worked with the relevant authorities to deal with their regulatory issues. And when I say regulatory issues, we are talking about registration with Tourism Authority, we are talking about Fire Service, we are talking about EPA, we are talking about Food and Drugs Authority. All these regulatory agencies, I can't mention all. A number of our regions have still not worked on this. Culture of maintenance for our bus is also a key concern. In more than half of our regions, the buses are still left under the sun, the scorching sun. There is no good system for maintaining logbooks. These bugs have dents on them, and we don't make early efforts to get them repaired. And so we are encouraging our regions to keep a good. The other one is asset register. A lot of our regions still do not have an up-to-date asset register. Having an asset register helps in knowing the status or to be able to value the hotel. It also has insurance implications. And so it's important that we keep our asset registers up to date. Compliance with financial management policy. We have a financial management policy. And the financial management policy indicates how specific financial controls should be done. So we do not need to reinvent the wheel. If anything, we could make recommendations for improvements. If auditors come, they would audit you based on the policy you have currently. So we need to comply. Some of our hotels have done well when it comes to signage or signposts. We are encouraging all to do same. Then the bit about directional signs, action plan for management meeting, hotel management meeting. Now, it's expected that when you have a hotel management meeting and you agree on key action points, it's important that you come out with timelines, assign responsibilities, and let it be cleared out to be able to track progress. Almost all our facilities, in fact, all our facilities, including the National Secretariat, have no functional fire hydrants. And that is a huge risk. In fact, if you go to the regions, the structure is there. But when you open it, there is no water flowing through. And when you come to a place like Northern Region, for instance, it's a huge challenge because they have significant challenge with water. So it's an issue we need to address. Should there be fire in any of our facilities now, we will be struggling. Then filing for secretariat documents. It's important that we maintain appropriate filing system so that all our documents are easily accessible, so that when you are not in the office, somebody is available to get those documents. We also have regions where staffs are working without appointment letters. Now, we understand the basis for maybe you want short contracts and all those things. Please give them contract letters and state the duration in those contract letters, because it has huge legal implications when you do not have appointment letters for these people. Then appraisal of our staffs. Then it's also important that when you want to terminate the appointment of staffs, please do it ethically so that you don't get found at the wrong side of the law. There are regions where we are currently in court over some of these things. And an extension of the asset register issue is asset labeling. Then maintenance schedule for our generators. The generators are very expensive. The cost of maintenance is equally expensive, but if you consider the maintenance to purchasing a new one, it is better you maintain the maintenance schedule. Now, a huge intervention was made when Madam President took up. There was an attempt to run a GRNMA mall. And some vendors were managing the mall on our website. We realized that with time, the prices were being inflated. Hold on. Back to the presentation. The prices were being inflated, and we were having various complaints.
Just a small correction. When we took over, we signed them on to provide the system for the email. That was in 2020.
Okay.
Please continue.
So, Madam President and Council tasked the PPME committee to work on a model for running a nurses mall or an email. So we did a piloting. This was what we did. We first drafted a policy that would guide the operations. Then for the operational process, So we requested for 1 million Ghana cedis to start, but we were given 200,000 Ghana cedis, which we used in starting. So we did an application cycle where we do advertisements, maybe on quarterly basis. 6 weeks advertisements, then you submit your request, then we get your details, give to the loans board, you now apply through the loan. After all this process, the ceiling for the items you can purchase was pegged at 6,000. We also made room for parts payments with cash. When we finished the piloting, these were the lessons we learned. Some applicants applied via the app. There were also phone calls, various modes. We also tried using Google Forms. Then the phone numbers we got, we tried getting back to the members to get their feedback as to how they felt. We tried engaging all members who went through the process. Only 23 were successfully engaged. 10 applicants had difficulty navigating the email portal. 5 applicants had lodging requests pending for over a week with nobody attending to them. Then 5 applicants called the hotline but never received a response. 2 applicants reported that upon calling, the receptionist at the National Secretariat informed them they couldn't assist. This left them disappointed. 15 applicants observed price discrepancies between the email and the SMS price alerts, with the email often showing lower prices. Then 7 applicants complained that the process was too slow and complicated. So basically, after all these findings, these were the strategies we put in place. To upgrade the web page to enhance efficiency, which we have done currently, we have registered 2 members of the committee and 1 to control the back end so that the response to members will be faster instead of leaving it to the software developer. Then we are having one of the association IT officers also joining the back end. We have worked with loans committee to have a system in place so that by the time you finish the application process, your details are already generated for the deductions to go on your payslip so that you don't have to go through a cumbersome process of doing that. We have also completed negotiations with Electroland Ghana Limited to be a wholesale distributor. What this means is that we have successfully registered with them that, for instance, instead of, if somebody is selling the items, let's say Samsung Galaxy Z Fold 7, if it's being sold at a retail price for 24,000 Ghana cedis, what this means is that we are not buying it at 24,000 Ghana cedis as an association, but we'll be getting it at the wholesale price. So even if we are selling it at a retail price of 24,000 Ghana cedis, instead of buying 24,000 cash, you would have the opportunity to pay for that, the same cost on the market on installments over a longer period of time. So we know the banks operate a similar system, but if you consider how much you pay at the end of the month, you would have paid like 3 times the amount. So that's basically when we finally completed the deal with Electroland. Now, online. So we want to have a try of the mall. So if you Google GRNMA Mall on your phone, let's use our Android phones quickly. GRNMA Mall. Smartphones. Smartphone. The iPhone people are not happy with Android. Oh, sorry. Okay, so what is required is that when you come onto the mall, when you load the mall, on the top right corner, you'll be required to register. So here, this is my colleague's profile, Rebecca Okraku. So you'll be required to register, where some details are expected of you to be provided. Once you provide all those items, all you need to do is now you can save the website, then you pick the item you want, you add the item to cart. Just like when you go to any online shopping, you add the item to cart, then you exit the cart. When you are exiting the cart, you are asked for payment modalities. In fact, we are working with Haptel, PayPal, to finalize that process, which we are hoping that by first quarter next year, it will be fully operational. That if you want to pay for the item in cash, you can pay Mumu. If you want to pay part of the money in cash and pay the rest in installments, we've made room for that one too. Then if you want to pay for all in installments, we've made room for that one too. I think because of the technical challenge, if we, at the appropriate time, we'll try and work with the maybe via a Zoom line and take all district executives through the registration process. But be assured that the committee is available 24/7 and you spend less than 24 hours to get approval when you register. So on the strategic plan, budget was approved. The work was presented yesterday. Now, so recommendations. I mentioned the bit about the green. Then we are recommending that we have a cloud space for data and information storage so that we do not lose all this knowledge over time. They are available in cloud instead of being on individual laptops. We also hope to fully integrate the work of PPME into other committees, finalize and secure National Council approval for the policies that are not approved yet, then assess educational materials online and make recommendations, identify courses related to policy planning, leadership, and seek for sponsorship, identify and understudy persons with experience in policy leadership, explore and compare policy implementation strategies of other nursing associations in Ghana and beyond. We don't want to be an island. We want to get better by the day. Inquire about existing training for committee members and attend educational training platforms. Review existing documents. We need to start doing policy dissemination so that members are aware of these policies. Training and capacity building. Develop a survey to assess knowledge of members on the policies and their satisfaction with them. Then we want to also look at the national nursing policies and other health-related policies and make recommendations. We want to put all the policies, instead of being isolated, into one policy booklet. Monitor the uptake of the GRNMA newsletter. Continue to provide reports on quarterly basis to National Council. Then monitoring and compliance engagement meetings with standing committees. The newsletter, we want to ensure that we monitor that it's produced on monthly basis. Then also encourage annual performance reviews in our regions. Thank you.
Thank you so much, PPME committee. Please, let's do it better for them.
Madam President, with your permission, I just want to add one or two. Conference, for your information, the mall is delayed in rolling out because of some technical challenges like he mentioned. But I want to assure you that it's virtually running as at when you indicate your request. We have not rolled it out like we wanted. The distributors, we have identified 6 regions. Electroland has given us 6 regions where you can walk in and pick your item from the shop. So we are negotiating with them to find points for the other 4 regions so that no region is left out. But for now, the 6 regions, we have identified where there are Electroland sales points. Like in Tamale, there are 2. They gave us one at Agrek and then another one around the Kumasi Road. So you walk in there, get the invoice, send it to us, and you are good to go. We are working with the loans board to see how we can route the mall through them so that we can ring fence the amount that we have. Recently, Madam President has released 300,000 Ghana cedis to support the mall operation, which we have granted to the vendors, the wholesale persons, that's Electroland. So we hope that when the loans are able to route the mall sales through them, then we can ring-fence what amount we have and protect it and increase more. We intend to bring in more vendors apart from Electroland and also go on the international shops like the Alibabas, the Timus, and so on. And our desire will be to have a distribution van, okay? Where we can use the van to move around to distribute the items to our members at their various locations. So be patient with us and support us to develop a comprehensive e-mall system, and it shall serve all of us well. Thank you very much for your patience.
Disciplinary committee, please move to the stage. Let's put our hands together for PPME. Disciplinary committee will be followed by the transport committee, and after transport, the youth committee.
Good afternoon, distinguished delegates. Akolko Samuel, as usual, is my name. I am right. Our committee is made up of 5 members. In all the committees that I serve, I'm the most senior and the older. But this particular committee, I'm privileged to be the younger. It is made up of our former president, Mrs. Alice Asari Dakwa, who is the chairman of the disciplinary committee, followed by another former president, Dr. Asante Kweku Krabia. He is a member. Then the mother of Ghana Health Service, that's Director of Nursing and Midwifery, Madam Eva Mensah. Then my good self, Secretary to the committee. Looking at all these heavy personalities, you know when you misconduct yourself as a member, what they will do to you. So, considering the fact that we don't have much time, what I intend doing here is just to introduce you to the disciplinary code of conduct of the GRNMA. We've done a number of dissemination of the documents. So let me find out how many of us have heard of the disciplinary code of conduct of the GRNMA. Let's see by hands. Okay. It will be uploaded on our website. So let me just quickly, is this working? You will agree with me that all of us are coming from different backgrounds. We have various levels of education. We have various levels of exposure. If we are, which of our standard are we to take as a guide for our conduct? It is for this reason that Madam President, when she took leadership of the association, said, look, we are growing. and there are some disciplinary concerns, I will put in a disciplinary committee which will help us regulate the conduct of members. So that is the reason why the disciplinary committee was formed and tasked to develop a code of conduct so that all of us will apply ourselves to it, so that we don't use one person's standard to judge everybody. This is a universal standard that we are using. If you look at, okay, let's go. Now, the legal basis or the fundamental basis of this code of conduct is 1, the Health Professional Regulatory Bodies Act. How many of you are aware of the law that regulates nursing practice? Let me see your hands. The law that regulates nursing practice in Ghana. Let me see your hands. Then this particular discussion is really very, very important. It is the Health Professional Regulatory Act. And that of nurses is in part 3. So it is on Google. You can get it, read, and know your responsibility as a professional. We also are relying on the code of, the Ghana Health Service Code of Conduct. It is also applicable to all of us because that is the employer's code. Then we have the ICN and ICM Code of Conduct respectively. These were the documents that guided us to develop that our disciplinary code of conduct and disciplinary proceedings. The guiding principles. We are looking at the relationship between nurses and midwives and the general public. What this means is that your conduct with the general public, if it brings any disgrace or any discomfort to the name of the association, you can be disciplined. So for instance, you are wearing GRNMA identifiable something, either shirt or drink, and you are found drunk by the street. They will bring you to us, and we will apply the appropriate measures. Nurses and midwives and practice. Our conduct is not only limited to the public space, but even at our workplaces. Sometimes when we want to discuss the conduct of some of our members towards patients and their relatives, then the media will just pick that component and start whipping. But they will ignore the sufferings and the frustrations nurses and midwives are going through in the facilities. So sometimes we are hesitant to talk about these things when we are engaging in official setting. But this is a fine opportunity for me to draw our attention. The picture out there is not good for us. Majority of us are doing our best, but few are drawing our reputation back. So it is our responsibility to ensure that whoever that we are working with, let's assist them to conduct themselves in such a way that we will gain our olden days glory, where if you were standing in uniform, you don't need to do this. The drivers will stop and pick you. I know one particular driver in Tamale here, wherever he was going and he meets a nurse, he will tell the passenger that, look,
this person is going to save life, he would turn and send the nurse. Finally, he was awarded and made a driver of the Tamale NTC. Tamale NTC. So this is how we should project ourselves. Nurses, midwives, and co-workers. That professional rivalry. Oh, we are nurses. These people are other paramedics. We are the important people. Look, we are working as a team. Everybody's contribution is geared towards giving the patient the healthy service, the quality service that he has anticipated before coming to us. How come that when you go to the private facilities, we are at our best? Oh, please, sir, what can I do for you? We even speak slangs. But for the government facilities, what is it? Please, let's make sure that we conduct ourselves in such a way that the public will always applaud us. If you say you were not aware of what I'm saying now, but I know you are aware, make sure that you change from today, because God is listening. He has asked me to tell you to change from now. If you have not been doing something right, if you are not sure whether you are doing it right, look at your colleagues. Thank you. Here, usually we are not targeting the individual. If we call you for disciplinary proceeding, it is not because we hate you. We want to punish you for the conduct, but not you. Do you understand? Those of you who did psychology, they will tell you that you can separate the individual from his behavior. So we will separate you from the offense. Even though you created the offense, our target is not you, it's the offense. But when we apply the sanctions, you will what? Remedy the offense. So that is the aim of this document. We want to be fair. You can't just come and say that so and so did this. Chairman of disciplinary committee, discipline him. No. Make sure that you have the evidence. Make sure that you are ready to be examined by the person you have accused. Don't come and say, oh, I'm just telling you, but don't let him know that I said it. So if I'm speaking to the person, who will I say said it? God or the devil? So if you want to report fully, and we will look at it. Fairness, and then it's what? To prove. Yeah. In fact, I'm an attempted teacher, so when I start, usually, okay, these are the core values. If we are able to look at this, respectfulness, it's not costly to be respectful. Responsive. Sometimes we get to our various working units, we are not prepared. And I always tell people, when you get to your seat, ask yourself, if you are in emergency ward, ask yourself, if they bring in a patient who is not breathing, what and what do I need? You get them ready. If they bring in a patient who is bleeding, what and what do I need? You get them ready. If they are not in the hospital and the patient comes, you don't get up and start running around because you are sure that it is not there. You concentrate on the patient, what you can do. But make sure that those things that are not there, you have informed whoever that is responsible to what. And that blame is shifted on another person. If you don't say it, the person will come and say that, if you had told me, I would have made provisions for it. So please, don't create problems for yourselves and going around saying that these days we have to be prayerful. Oh. You must handle yourself and the prayer will work. Otherwise, okay. So let me just summarize. We have two major offenses. This major categories of, two categories of offenses. Major offenses and minor offenses. When I say major, it means the punishment will be heavier. Let me make general terms. We have punishment for executives, and we have punishment for members. That of the executives is heavier than members. One of them is, if you appear before us, we can recommend that your position should be recontested. So as first vice president, if I misconduct myself, the committee will recommend to the National Council, organize an emergency congress and re-elect, because this person is what? A nuisance and a subtraction to the value of the union. You can imagine, if you ask those who have campaigned before, even at the district level, it's not a small thing. It's not a small thing. So distinguished ladies and gentlemen, just be aware that we have a disciplinary code of conduct. We will mount it, read it, and then be abreast with it. Thank you very much.
Thank you very much, First Vice, for the presentation for the disciplinary committee. You didn't take your picture. We'll have the transport committee do their presentation now. And do me a favor and do it within 10 minutes. Transport committee. Transport committee.
Good afternoon, conference, and good afternoon to Madam President and the team. This is Transport Committee, and my name is Alhaji Al-Hassan Abukari, the Regional Chairman for Northern Region. I have my colleagues here. I will allow them to do self-introduction. Starting with this one.
Davis Kwekuopong, Committee Secretary and Western Regional Secretary.
At least clap for him now.
Mercy Apandia, Eastern Regional Treasurer.
Please, I am Kingsley Osei Safo, a member, Brown Hartford Regional Chairman. Thank you.
And then I am Kofi Adams, a member and Assistant Regional Secretary, Greater Accra.
So you see that we have the men and the woman. We have the men and the woman. Our presentation is going to be very brief. In the course of the year, we haven't really had much to do. So, Madam President, we'll save you some time. The outline of the presentation, we'll just give a little introduction, the work we've been able to do so far, a plan, and then the recommendations, and then we conclude. So, as you are aware, we are a part of the standing committees of the GRNMA, and we have a membership of 5 as we have just introduced ourselves. And the names are here as well. Our terms of reference to make recommendations to National Council for their consideration on the transport needs of the association, then to determine the transport needs of the general membership in terms of their personal vehicles, have oversight of the maintenance and insurance of the vehicles, and work with NEC on getting the government of Ghana to reinstitute vehicle imports waiver. I believe this is a very important subject area that maybe in this conference, I'm surprised that it has not come up. But as I have mentioned it, I know during question time it will come up. And I believe you will remind Madam President and her team strongly that we need it. Fortunately, yesterday in President's presentation, this came up, or was it General Secretary's presentation? The total fleet that we have. At the moment, our fleet is not too much. We have 5 pickups at the national headquarters, and the breakdown was given. We have 3 Hilux pickups and then 2 Nissan Navara, which are quite a bit old, but the Hilux vehicles are within 2 years. They are just 2 years old. The others are close to 10, if not more, and so they are not so strong. You also are aware of the minibuses that we have at all the regional secretariats, and our 1 Toyota Land Cruiser for our esteemed president. There is another minibus at the headquarters, and then the motorbikes that is at our various administrative districts. So with regard to the motorbikes, Greater Accra have 15, Northern Region have 30, Western Region has 23, Ashanti 40, Ashanti has 43, Volta has 27, Central 23, Upper East 15, Upper West 12, BA 29, and Eastern 33. Each has a minibus. In the course of the year, what were we able to do? We were able to review our national transport policy to guide us on how we operate our vehicles, both at the national secretariats and at the regional secretariats. We were able to also digitize a data collection tool to enable us collect data on how our vehicles are used, especially looking at the mileage coverage and to guide us in the maintenance schedule for longevity of the vehicles. And our regional chairman and their secretaries have been doing well in that regard to report appropriately, so we see what we can do. Institutionalizing the robust system for monitoring of the vehicles, like I have just mentioned, because it is mandatory that every vehicle has a vehicle logbook that gives us information at any point in time. Then we're also able to auction the Nissan Patrol vehicle in collaboration with NEC, as was discussed in detail yesterday. Just a couple of challenges. Delay in submission of quarterly reports on the transport data from the regions. And this is a major issue which have to do with robbery of some of the district, or burglary. Some of the vehicles, specifically the motorbikes, being stolen from our district secretariats. One other challenge which we have not captured here has to do with safety. The use of the motorbikes coming with some accidents, among other things. And so we are encouraging district executives who are using them to always protect themselves whenever they are using the vehicle. We'll continue to liaise with the procurement committee to purchase vehicle trackers for the vehicles that will still help us to track and to identify if one of the vehicles is missing. And then we are also intensifying the call on the government through our national leadership to ensure that the tax waiver on the importation of personal vehicles for nurses and midwives is also achieved. Earlier, there was also a suggestion or members also calling for the association getting motorbikes for them to buy on hire purchase. Now that the mall is coming, we will link up with the mall to see how that can also be factored in. The major problem with that was the exchange rate fluctuation. And so we will see. The experts will advise us if it is feasible to be able to implement. We will continue to collaborate with the other committees because you realize that independently we don't have too much to do, but to work with other committees to be able to achieve our objective. We want to use this opportunity to thank Madam President and her team for providing us with good leadership. We'll continue to pray that they give the Transport Committee more attention, and especially the regional chairman and secretaries have been pushing behind the scenes through us